Good morning, everybody. It's Dr. Jared Skowron from Spectrum Awakening. We're going to talk today briefly about inflammation with autism, okay? Now, inflammation is such a big kind of general word. What does it mean and what does it have to do with autism? So, inflammation, what does that mean? It's a very broad kind of term. And what I want you to start with is kind of a thinking of what is inflammation in general. So let's pretend most of us have probably sprained something like sprained an ankle, okay? What happens when you sprain an ankle? Well, you twist it and all of a sudden it swells. It swells, it gets big, it gets red, it is inflamed, okay? Why is that happening? Well, the body senses something is wrong, okay? Maybe there was a break to a part of the body, such as a blood vessel or a tendon or a ligament or a muscle or whoever, and all of a sudden, the body wants to heal. And how it heals is sending all the good stuff down there. And so sending all the good stuff down there is through the blood. And so what happens is the inflammation occurs and basically the blood vessels kind of open up. And so with the blood vessels opening up, the blood kind of leaves the vessels and goes into the area of the inflammation. And all the things that are in the blood that will help and heal are able to access that area and heal and let the body get better. While the body's healing, boy, you really can't use that ankle now, can you? Okay, the whole ankle kind of freezes up. You twist it one way or the other the wrong way, and all of a sudden the pain is huge. You know you can't be using that part of the body while it's inflamed, while there is inflammation, all right? Now, inflammation is a good thing because it creates healing, but it can be a bad thing if it goes on too long. It can also be a bad thing if that inflammation turns into what's known as autoinflammation, which is the body attacking itself. So this is where we kind of go from just general inflammation. Hey, guess who's got inflammation right now? My sinuses and my nose, okay? Everything is inflamed, everything is enlarged, my vocal cords have expanded, and that's why I've got this deep voice. With my cold, it's because of inflammation. My inflammation will stop. Okay, and it will go away and I will return to normal because whatever has infected me is being killed off by my immune system. So the inflammation short term is good. It's healing. It's a helpful thing. But long term, it can go on for too long. And going on for too long, it can cause damage. And if we go overboard into autoimmunity, then the body is attacking itself and could be attacking the brain. So this is what we're going to talk about today is how is inflammation associated with autism and what, gosh, can we do about it, okay? Excuse me, I got my tea here, so I'm going to be drinking tea throughout the Facebook Live. Luke, I am your father. Okay, just practicing my James Earl Jones. I'm not that deep, but it feels good to pretend. All right, so I've got some fair amount of research studies to show today because inflammation is so associated with autism. So here's the first research study, and let me get excuse me. There we go. Here's the first research study: the contribution of inflammation to autism, recent clinical evidence. Okay, and this talks about different levels of inflammation that are occurring inside the brain that is associated with autism and with other developmental conditions. Here's another research study that talks about how atopic disease is inflammation of the brain in the pathogenesis of autism. Let me kind of clear up some of these big words. Pathogenesis just means cause, and atopic disease is a combination of asthma, allergies, eczema. So do kids who have asthma, eczema, allergies, are they more predisposed to having autism? And that would be due to the histamine connection, okay? So people who have a large problem with histamine are gonna have much higher rates of eczema and allergies and asthma. That can also affect a lot of our kids with autism because histamine is a stimulant in the brain and can cause a lot of behavioral problems, okay? I like Linda's question here. Lots of public reports coming out of the dangers of Tylenol. I love that topic, Linda. That's one of my favorites. All right. Here's another one that talks about autoantibodies in the brain affecting autism. Here's the role of the immune system in autism spectrum disorders. Looks at 20% of those who have anti-brain autoantibodies. And again, anti-brain autoantibodies kind of crosses into this pandas pans arena where we have an autoimmune condition against the brain. So is an autoimmune condition against the brain pandas or pans? Is it autism? Is a little of both? Okay, this is what we need to discover in science. Here's another one that talks about the inflammation affecting mitochondria. So inflammation and mitochondrial dysfunction in autism disorders. So the immune system really needs mitochondria for energy. And so this inflammation requires a lot of energy, and the mitochondria really have to be churning this stuff out. If you don't have the mitochondria to produce that energy, you may have some imbalances in inflammation. You may have inflammation that doesn't stop. You may have this autoimmune issue. You may have a lack of an immune system. I mean, so many of our kids who have intestinal candida or mold or bacteria or parasites, we will test their immune system of the gut and be absolute zero. So we have kids with frank immune deficiencies of the gut specifically, not of the bloodstream, just the gut. Okay, real interesting stuff. And that, if you've done stool tests, that's known as IgA. So IgA is a marker of antibodies, good, healthy antibodies inside your gut. And I remember a patient, I don't know if it was 1 week or 2 weeks ago, we did their stool test and their IgA was low, and we did a blood test and their IgA was low in their blood. So big immune system deficiencies, overactivities, it's all over the map with autism, okay? Now, what do we do about it? Well, here is the talk. Here's actually, you know what? I'm going to do this later. I've got this a little bit out of order. Let me jump onto this one. Now, I want to kind of go back to, I forgot whose name it was, but mentioned Tylenol. So let me show you my favorite Tylenol study, hands down. Okay, this is it. I love this guy. I interviewed this guy in one of my courses. So we do have some online courses. Some are free, some are a fee. This is part of the free one. It's called The Story of Autism. I got some interviews with some scientists, including the head researcher of this study. This is a study by Duke and Harvard. Okay, Duke and Harvard scientists did this study. I love William Parker. I think he's super smart. I think he's onto something. This is the role of inflammation and acetaminophen, also known as Tylenol, for those of you internationals, Calpol and paracetamol. All right, they're all forms of acetaminophen. Inflammation and acetaminophen exposure from birth to early childhood can induce autism, period. That's what this research study is talking about. And I think there's a whole lot of value to this because some people are predisposed to Tylenol toxicity. And they're researching, can the Tylenol toxicity early in life cause autism? And this is what they're concluding is when you combine inflammation, a fever, and Tylenol, all of a sudden you get these developmental regressions. I reached out to Johnson & Johnson. They own Tylenol. They said, hey, we've got these research studies out saying this. Can you show me the safety studies? Literally, my question was, show me the safety studies that you checked Tylenol does or does not cause autism. And they sent me back some form letter that's like, if you'd like to enroll in a research study, please contact Johnson & Johnson. So they kind of dismissed me, and I've got that letter on our course. So if you want to see the interview with Dr. Parker, if you want to see more of this research about Tylenol, go to that course, go to our website, spectrumawakening.com, click education. It'll take you to our course website. Look for The Story of Autism. It's free. There's no charge for that course. And take a look. So Amanda said, is Calpol Tylenol? Yes. Tylenol, acetaminophen, Calpol, and paracetamol, all the same thing. 4 names for the same exact thing. All right. And there's also another guy, a military guy, I think he was Navy, who he believed his son got autism from Tylenol poisoning. And his name is Schultz. And so he wrote some papers. He wrote a book on it. Real interesting stuff. So, you know, what's also interesting, most people know, Tylenol has an antidote. So in every emergency room, if your kid swallows a whole bottle of Tylenol, you got to go and get the antidote for Tylenol poisoning, okay? Too much is poison. There is an antidote. In fact, there's a new drug, which is IV Tylenol, and it includes the antidote in the IV, okay? Which on one hand is good. Hey, we're preventing toxicity. But on the other hand, why are you injecting me with something that could be poisonous? Period. That is the question to our scientific community. Why do you need to include the antidote in an IV Tylenol? Why can't you use something that's not toxic, okay? Just because we've used it for decades doesn't mean we should keep using it for decades, okay? So the whole thing with cigarettes. Hey, we smoked for hundreds of years, and now we're all like, oh, maybe we shouldn't get lung cancer, okay? So Mary said it's scary. Yeah, you bet it's scary. And there are certain kids who have certain genetics, glutathione genetics, that predispose them for a higher risk of Tylenol toxicity. When do you go get Tylenol, huh? When your kid is sick, or you go to your pediatrician. They're like, here's a shot, take some Tylenol. That combination is what these people at Duke and Harvard are researching and saying, hey, maybe this little triad of things is a problem, okay? Moving on. So, how do we treat it? We need to treat, treating inflammation can be a difficult thing. Number one, we don't want to add any more inflammation. So one of those things we can do is change our diets. So a lot of the gluten-free, dairy-free, a bazillion diets out of there are anti-inflammatory. You're taking away foods that are inflammatory. That's why these diets work for many people, along with some other, receptor blocking issues, etc. But it's about inflammation, all right? So going down those diets can help reduce inflammation. Also, there are 2 supplements that are wonderful anti-inflammatories. The first one, and I'm going to talk most about this one, is called PEA. Okay, PEA is an acronym for this chemical called palmitoylethanolamide. Big, long chemical name. We took this last year, or 2 years ago, I can't remember. I've got that COVID quarantine brain. Like, what year did that happen? I don't know. So 1 or 2 years ago, we came out with a supplement called Panda Bear. Panda Bear is this anti-inflammatory chemical, palmitoylethanolamide, all right? We made it we made it tasteless. Okay, it's fat soluble, so you gotta mix it in some food, a little applesauce, a little peanut butter, that kind of thing. But man, as an anti-inflammatory, specifically a anti-inflammatory, PEA in this Panda Bear supplement is amazing and helps a lot of our kids. Okay, let's see some research behind it. All right, first, and let me show you how this thing is spelled. It's called palmitoylethanolamide. It just rolls off the tongue. Beneficial effects of palmitoylethanolamide in a mouse model of autism. So again, this is an animal study, but it does suggest that it does control inflammation in the brain. It talks about inflammation of the mast cells and the microglia, okay? Here's another one. This is a clinical case study of 2 cases, beneficial effects of palmitoylethanolamide on language, cognition, and behaviors in autism, okay? Next. Palmitoylethanolamide counteracts autistic-like behaviors in mice. So again, another animal study, but showing that PEA does help by supporting neuroprotection, anti-inflammatory, and modulation of the gut-brain axis. What's it all says here? I apologize, I normally highlight these. I just got to work late because I'm not feeling too good, so I didn't highlight all these, but you get the idea. Okay, the potential benefits of palmitoylethanolamide in palliation, and again, it talks about improving depression, Parkinson's, strokes, autism, all with a natural anti-inflammatory. Is that not enough for you? Here's more. The potential benefits of palmitoylethanolamide in palliation. Wait, did I just... hold on, I printed that twice. Just to hammer home the point of it. All right, here's another one. Palmitoylethanolamide as an adjunctive therapy for autism. Safety and efficacy results from a randomized controlled trial. This is what we want to see, a double-blind, placebo-controlled trial. What they found was that there was a trend to improve language and significant change in language, social withdrawal, and stimming. That's what this research study showed. Okay, here's another one. An update of the palmitoylethanolamide, and again, this luteolin is an antioxidant, but you can get antioxidants anywhere, in the effects of preclinical and clinical studies of neuroinflammatory events. Look, this is just a year ago, 2020, March of 2020. Nettie just said, does it work for teenagers? It works for anybody. Anybody, it can be improved. Age does not matter, okay? This research study talks about how it does improve neuroinflammation, all right? And again, a lot of the same things here, but you're getting the point. This is a wonderful anti-inflammatory. Palmitoylethanolamide and its biobehavioral correlates in autism spectrum disorders. Look at this. This is April of 2021. This research study just came out, okay? And it talks about how PEA can improve language, social and non-social behaviors by improving immune response, neuroinflammation, neurotrophy, apoptosis, neurogenesis, neuroplasticity, neurodegeneration, mitochondrial function, and the microbiome, and possibly a little PPAR activation. If you don't know your PPARs, you should. PPARs are pretty cool. All right, so PEA, you gotta try it. Okay, if you haven't tried it yet, please try PEA. We have it in our Panda Bear supplement. It is a tasteless powder. It's wonderful. You can take it with anything. And Crystal says this is what's in Panda Bear. Yes, PEA is the active ingredient in Panda Bear. It also has a little vitamin A, vitamin D, vitamin E, and vitamin K. But yeah, PEA can be wonderful. We have had kids start a PEA and improve their language in days, okay? Doesn't work for everybody. Nothing does work for everybody. but it can help. I saw a question go by. I wanted to answer it now. Are there side effects? It does stimulate some people too much. Some kids get a little bit hyper, a little bit agitated, little sleep problems. If that happens, just stop it and move on to something different, which we'll talk about in a minute. And again, our Spectrum Awakening supplements, we got a 30-day money-back guarantee. Why? We want you to try things. We know the right supplement will help your child, but not everything helps anybody. We would rather you try something, see if it works. If it doesn't work, 30 days, send it back, okay? Try what works for your kid, period. All right, moving on. And there's really no other, I've seen a lot of questions on contraindications. There's no contraindications about taking PEA. Anybody can take it. All right, will it help everybody? No, but it'll help a lot. Excuse me, can you hear it in there? All right, next, what other supplements are wonderful for neuroinflammation? Fish oils, fish oils, fish oils. Fish oils, omega-3s are so good as anti-inflammatories, especially for the brain. Here's the role of omega-3 in human neurodevelopment and autism and ADHD. It did show improvements. Let's take a look at what kind of improvements. Let's see. Doesn't say too much in the abstract, but it definitely associates a low omega-3 level, especially low DHA, as a risk factor for autism and ADHD. Okay, next, here's another research study on vitamin D and omega-3s and improving the irritability and hyperactivity of children with autism. Okay, here's another one. Neuroinflammation, plausible role of omega-3s in the microbiome. Again, talking about how omega-3s, fish oil, can really help decrease inflammation. Last research study, here we've got omega-3, the little Greek W there is omega. Omega-3 and omega-6 fatty acid supplementation may reduce autism symptoms, okay? And again, what type of autism symptoms are they talking about? They did a panel called the Brief Infant Toddler Social Emotional Assessment for Autism. That showed improvements in our kids with the omegas. DHA seems to be much more needed than EPA, but both are good. So where do you get these fish oil supplements? There's a lot of them, okay? I mean, there's so many brands out there for different omegas. You've got to get what your child will take. We've got some omega supplements as well. Really high quality. Of course, all our stuff is gluten-free, dairy-free. We've got a few different forms. We've got soft gels, which is called pure fish oil. We've also got vegan gummies. So if your kid wants a gummy, I call them yummy gummies. Yummy gummy omegas. And lastly, we have a new fish oil liquid that tastes like bubble gum. So it doesn't taste like fish. My big issue is a lot of the liquid fish oil supplements, they taste like fish. Okay, that's gross. Who wants that? Not many people. Okay, but oh no, there's fish listening. No, it's a lot of people can't handle the flavor. So it's a bubblegum flavored liquid. Does not taste like fish. It's awesome. So that's what we've got. Again, a lot of fish oil supplements on the market. But if you want something, you know it's gluten free, you know it's dairy free. You want that taste, whether it's the gummy or a bubblegum liquid. Try our stuff. All right. So I think that's kind of I'm looking around on my desk here. I think that's kind of a good place where we're at. Thank you, Hamreet, for the donation of the stars. I think that's a good, let me kind of do a roundup. Inflammation, okay? It's part of healing. It's a good thing in small doses, okay? That's what my wife tells me. She says, you're great in small doses. So you want the inflammation, but you don't want it to go on too long. And you don't want to fall over into autoimmunity where the body is attacking itself, especially the brain. So if inflammation is a problem, we do want to decrease it. Now, how do you know, okay? It's kind of tough to tell clinically. There are no amazing blood tests that I've seen that will measure neuroinflammation. You can do a spinal tap, but who's going to do that on a regular basis? And you can do SED rate, and you can do ANA, and you can do other kind of markers, but it's not too accurate. So what I would usually suggest is try it. Try Panda Berry. Try a fish oil supplement. Claudine just said, what's the bubblegum fish oil liquid called? Just go on, it's all under fish oil. So if you go to fish oil, there's different types you can get. So there's, you can click gummies or soft gels or liquid. So Inflammation can be a problem. Decreasing that inflammation can be amazing for certain kids on the spectrum. How do you know? I would try and see. And again, that's why we have the 30-day money-back guarantee. You try Panda Bear, you try our fish oil, you don't see huge changes, send it back within a month for a refund, okay? We want you to try this stuff because we're here to help your kids. We want to give you guys the highest quality treatments that can help.